And welcome to the Take a Breather podcast with Stacy Every and Eric Almeida. As always, please give us a 5-star review on Apple Podcasts, like and subscribe on YouTube. Those help out us and the podcast a ton. We greatly appreciate it. And today we have a lovely guest. Her name is Bonnie Diamond. She is a licensed acupuncturist and the owner of Staying and Balance Acupuncture based out of East Hampton, Massachusetts. Welcome so much, Bonnie, to the Take a Breather podcast.
Good to be here.
It's so nice to see you. So let's just start off with the basics. You can tell us a bit about who you are and what you do for your modality.
So I'm a licensed acupuncturist. I practice a Japanese style of acupuncture. And the difference between Japanese acupuncture and Chinese acupuncture is, as Japanese acupuncturists, we get a lot of information directly from the body. So I feel the pulse and then I palpate, which means I'm pressing on various parts of the body and seeing where I feel restrictions. And this type of acupuncture is particularly good for pain because I know exactly where the person's experiencing pain in the body.
So when you say restrictions, are you meaning like muscular restrictions or energetic restrictions or both?
I think there's a connection between the two. I practice a Japanese style based on the work of Kiko Matsumoto. And she teaches that while the patient's lying on the table, you press and you ask them if they feel pain or discomfort.
Okay. So there's a big interactive component when you're doing
very
it.
Big, yes.
Okay.
Big.
Interesting. Very interesting.
Yeah. So as a massage therapist, so massage therapists, well, they're the ones I've talked to the most about this. And with long-term body work, we all find that we often develop, people would call it extrasensory, but I think it's actually a human ability to sense. And basically for me, it comes as a very visceral sensation. Like I can feel in my own body move, like energy movements. And I'm curious if you have a similar, like, I'm really interested in talking to more people about like what it is I might be sensing, if like we're sensitive to the moments of chi, or if so you mentioned like energy restrictions being related to, say, fascial or muscular restrictions. Can you speak more about like that whole that connection between the energetic and the muscular and the fascia and all that stuff?
So I think of it as all being one system, like the body is one unit. And as part of the body's unit, we have energetic restrictions, we have neural restrictions, we have vascular restrictions, we have musculoskeletal restrictions. When I'm palpating, and a lot of times I'll be palpating and the person will say, I didn't know I had pain there. How did you know? Very common. Or that, they'll come in like, my neck hurts, and there's a restriction in the pelvis that they really didn't know about, because people generally focus on where the pain is, where the greatest pain is. If you have 6 places in the body where there's pain, when a person comes in, they just generally describe where the greatest pain is. I've been palpating for so long that, first of all, I check everything. So a patient comes in, I do a health history, which is they fill out my intake form. It's 5 or 6 pages. I get, all of their information, what they're eating, what medications they're taking, if they're exercising, and what symptoms they're experiencing, and when the symptoms began. The worst symptom, the thing they're coming to me with. And then they come in and I palpate. And so we find out where in the body and initially it's a lot of it is, where does the patient experience pain? And part of the work is creating a space where people can have a greater experience of their body. So I don't think so much about, I mean, sometimes I think, is it muscular or is it neural? But I tend to think more about, where is there the restriction? It doesn't matter to me so much about how I describe that restriction. What matters to me is, can I free up the restriction?
Interesting. I realized, excuse me, a friend of mine turned me onto the book. I had a lot of questions about acupuncture, and she recommended I read The Web That Has No Weaver, because it does such a great job of trying to translate a paradigm we're totally unfamiliar with. Like I know, and I still struggle with this all the time. I think we're all trained from a very young age to think of everything in terms of pieces and parts. The neural system versus the fascial network versus the organ systems versus the nervous system, and finding a space where we can sit, where we think of it in terms of the wholeness. I still struggle with that, and I still get caught up in, well, is this muscular or is this energetic? Is this something with the organ or is this something with their nervous system? Like, it's still so hard to just go with, here's the space of restriction, because it's similar for me too. I'm also dealing with, more muscular or fascial restriction. But and just go with, here's where the energy is clearly stuck. What can I do to release it? And that's really the fundamental principle, it sounds like. So for you, I assume it's palpation, the needles. Here's the restriction. Here's my tools I have to open up that restriction. That's kind of the fundamental plan of attack, I guess, for lack of a better term.
So one of the things that's really interesting about Kiko's work is she combines classic Chinese texts with Western medicine. And so there's an autonomic nervous system treatment, there's a vertebral artery treatment, there's a sugar treatment, there's an adrenal treatment. So she takes the points that we all use and she explains them to us from a somewhat Western perspective, which is really interesting. I don't know of other acupuncturists who do that. A lot of them stay, in the 5-element, 5-organ system in terms of diagnosis.
Could you run through those, that system, just for folks who aren't familiar?
Sure. So we all use this 5-element, 5-organ system. And there's a whole set of correspondences that go with the 5-element, 5 organs. And so they're kidney, water, liver, wood, heart, fire, lung, metal, and spleen, earth. And so in the theory, and we learn this whole set of correspondences that goes with each organ element. And so like spleen, earth goes with muscles in the body, goes with overthinking is the emotional component. There's a certain color, it's yellow for earth. There's a certain sound, it goes on, and we learn some of those, but if you study it, you can find a whole set of correspondences. And the idea is that these are correspondences that exist in nature. So you see these things out in nature: earth, wood, metal, fire, and they also exist in the body.
Mm.
And when there's balance between the 5 elements, 5 organs, there's health. So in school, they often teach us initially to think of ourselves as gardeners. You know, where the soil's too dry, you add water. Where the soil's too wet, you wait for the sun to shine. And to think of ourselves as gardeners in the body, and to use acupuncture to balance out the body. That's the basic theoretical model. And many acupuncturists use that model exclusively to diagnose and treat. Is there too much heat in the body? Is there too much cold in the body? Is there too much wind in the body? What Kiko does is she expands that model to include what we now understand as Western medicine. So when the theory was originally put together thousands of years ago, over a very long amount of time, Western medicine was not a part of it because it didn't exist. So when people were, doctors, acupuncturists were treating, they used the 5-element, 5-organ model. Well, 200 years ago, we started to have Western medicine. And so she brings Western medicine into that. So it's a little more integrative than a lot of other styles of acupuncture.
Well, it sounds really helpful to have. I've often thought Western medicine should be seen as another modality, just like there's versus an overarching construct for the entire health condition of a human being. It's just should be one more thing to try, and that how often integrating different modalities together is just so fruitful in getting the results you're looking for. So it's nice to hear of someone taking that idea of Western medicine as another lens, another useful lens to look at the body. And it's a limit, and every lens has its limitations. It only sees the body from one perspective, or it can't see every aspect of the human. But integrating those, so Western and Japanese acupuncture together just sounds like a really fruitful combination when used judiciously. Interesting. So I guess I'm curious how that plays out practically speaking when when you're working with one of your patients.
So I get their health history. I palpate. So sometimes they know. A lot of times people come in and they know I have this condition. I have, I've been to the doctor. This is what the doctor's telling me. But they haven't figured out an answer to whatever their problem is. And with pain, we see this a lot because there really are not that many. When I say effective, I mean ways of treating pain that helps the body to heal in Western medicine.
Versus symptom management.
It's pain management if somebody has chronic pain. And so I see people who don't want to go down that route because they don't want to be on medication. And either they've had surgery already or they want to avoid surgery. So they come to me. So we have some sense of what's going on, generally, not always, but generally. And I think that's fabulous. There's definitely a role the doctors have to play, and it's very helpful that somebody's been diagnosed properly, so I don't have to worry about the 8 gazillion things that could be going on that could be dangerous, because a medical doctor has already ruled those things out. So the person comes in, we may have some sense of what's going on. We don't have an answer yet. And often they'll be told something like, well, I have arthritis. And they think of it as, I have arthritis, that's it. I have to live with my arthritis. That's the mindset that people come in with a lot, I have headaches. I have to live with headaches. And I present them with a much wider view of how the body can heal. And through palpation, so I'm palpating. And one of the ways about this particular style is that you diagnose as you treat. The two things go together.
Mm.
So I may think somebody comes in with lower back pain, let's say, and I may think, okay, I want to do my muscle treatment, which is spleen points, because muscle and spleen go together.
Mm.
And I go and I massage spleen 9, which is this point for releasing muscle pain in the body, and the pain doesn't release. So then I have to think, oh, okay, it must be something else. So lower back pain, it could be a weakened immune system.
Mm.
And if the immune point releases the back pain, then I have my sort of accurate answer. I use the body as a means of validating what I'm doing. And once I do that and the person realizes that they're not sort of stuck in, I have arthritis or I have headaches and I have to live with it, they realize, oh, there's still something that can be done about the arthritis or the muscle spasms or whatever it is that nobody's told me about, that I didn't know about.
Mm-hmm.
And so part of it is just getting them to feel better. Once they feel better, they don't have to fully understand everything. I don't have to fully understand everything. The body's a very complicated system. All I have to do is get them to feel better. And for a lot of people, it changes their perspective. I've had people cry on my table because I said, okay, you have arthritic knees, but you can still hike. We can still figure out, what can be done to relieve some of this. And I say to them, look, bone and tendons and muscle, this is living tissue. If we're in human form, our cells, our muscles, our fascia, it's all living tissue. And living tissue can heal. And so it's just this very beautiful kind of approach to wellness and treatment that I think is not the focus of Western medicine. The focus on Western medicine is when things go really wrong, how do we save the person? So, my role is sharing that there are a whole bunch of other things that you can do.
Well, it sounds also like that you since you have a Western piece in your brain when you're doing the work, that you actually can also then provide the patient with other avenues to try for, like you just mentioned, like I had never heard that before, low back pain could be from a weak immune system.
Yeah.
So, then going to the doctor saying, I have a weak immune system. What are some things, you can do for me? It's just taking that information. It's just so useful for the patient to have more information about what's all the things that might be going on in their body, and the empowering aspect of, oh, there are things I can do for myself.
Yeah.
To take that I'm not, I'm not stuck in, as you say, I'm not stuck in the pain, but I'm also not stuck helpless with my own body.
Yes. Yes.
Hmm.
Yes. And about 5 years ago, I started studying anatomy a lot. I was having lunch with a physical therapist and I said, I know that the meridians are connected to tissue, but nobody talks about what the actual connection is, because acupuncture, we're on an energetic level.
Mm-hmm.
And he said, you should take visceral manipulation classes.
Mm.
And so then I started not thinking I would really do that, because it's a huge program. It's been like 5 years of my life studying anatomy.
Wow.
Yeah. that gave me a deeper understanding of what I do.
Nice.
So that I now in my office, I have netters, I have the anatomy books. And so when a person comes in, I can say, okay, this is where, or is this where it hurts? Look, this is, we're on L5, S1. This is where your pain is. Here's the sciatic nerve. This is where the pain is. And so that added a whole other layer, the actual physical body, and learning about connective tissue and having greater understanding of the musculoskeletal system in more detail than I had before.
Mm-hmm.
And so I can give that more information about that back to my patients, which then give them a better understanding of their bodies.
Right.
That makes so much sense, like to have that extra layer of communication with your patient. So like when they come in, they say, I have an injury to this particular vertebrae. You can then be like, okay, I know exactly what you're talking about. I also know what energy system that it's integrated into and know where to go in for my modality. Like it's the merging of those two universes together, the energetic system with the acupuncture within the Western medicine model with, all of us being all these little different parts working as a system together. So that is very interesting. So I'm curious, you mentioned before how, like you said, with the lower back pain, you'd start with what makes the most sense. You went down the muscular route, and then you were like, okay, if that doesn't work, then let's try the immune system route. So is that like between sessions you're discovering that, or are you actively with the patient in the moment putting the needle in and being like, is this giving you relief?
So before I needle, I massage points.
Okay.
If massaging the point, so it's in the moment. If massaging a particular point, Kiko says, I don't like to waste needles. Waste needles. She says, if I massage a point and there's no change, and I want to be clear, sometimes the pulse changes. Like sometimes there are changes sometimes there are very apparent changes. Sometimes there are more subtle changes. I usually ask the patient, do you feel a difference? So I'm going by what they're telling me. Now, sometimes I feel the release and they might not feel the release. So I might use the point anyway, because sometimes their system's just so overwhelmed that we don't have good information. And in those cases, and some people are better at this than other people, this particular style. So I have patients who are like, Bonnie, just put the points in. So, I can't, a lot of people say it's like when you go to the eye doctor and they're checking your eyes and the doctor says, is this better than this? That kind of thing. A lot of my patients say, Bonnie, you just moved the pain. That usually means that I have the right point. I feel where you're pressing on the pain, but now I feel more on the point that you're pressing to release that.
Interesting.
Mm.
Yeah, like for myself, like I've only done acupuncture a handful of times, but not in that manner. Usually there is like the big preliminary screening like you do as well.
Yeah.
But then it's just, and then it's like the direction of where you want to go. It's like, I want to work on this issue or whatever it is. And then at least from what I've experienced, it's kind of like stick. And then they let you go. And then you just kind of lie there and let whatever happens happen. So this is different from what I've experienced. And it's very interesting, that interactiveness of of just the acupressure component, checking with the patient, checking with yourself as the practitioner, and being like, okay, is this where it should go? And then the funny comment about not to waste any needles. That's interesting. That's very interesting. It's very interesting.
It's the it feels like it's the Western slice, right? It's because Eric, as you said, I've had similar acupuncture sessions like that too, where it's you're dealing, it's very much system focused versus targeted work, versus and I think of Western as being having a very much sharper lens. Let's look at just that thing or just this area. And that's the piece that you bring into your acupuncture sessions, it sounds like, is we're looking at just this pain and just this one system, and not just treating everything all at the same time without that focus. But not saying it's just another way to do it, but it feels like that's like the Western part, is the zeroing in on a thing.
Yes, and I think part of that is cultural and how we were taught, and if you go to different countries where acupuncture is practiced, it gets practiced differently, even though we still have the same, we're still using the same points, same meridians, same theory. And so I think acupuncture has been more westernized in this country, just because of how it's taught and the system that we're all working in. We're all working in a medical system. We may be a little outside of the system, but it's still the system in this country. And I think we have to honor that, and bring that in. I think we should take the best of all the different, lenses and apply them. And also, today there is surgery, there is medication. So the whole way people go through life and are treated for various illnesses has definitely shifted. And we as practitioners have to adapt to that.
Yeah, it's really just inspiring to talk to you about this, because I hear so many stories as a holistic minded practitioner myself, who sends my clients off to various other holistic practitioners. They come to us when they feel failed by Western medicine. So often, I tried the cortisone shot, it didn't help, or they just gave me pain meds, is what and the complaints about the doctors not feeling like they weren't listened to, and they didn't get enough investigation, or they did investigate and couldn't come up with any reasons, and just the deep frustration they feel about Western medicine. But so it's just so nice to hear of all the ways in which Western medicine actually does function very well. Like there is a whole category of things Western medicine does beautifully. And if doctors, I think it'd be lovely to have a paradigm shift culturally, where doctors were more conscious of their lane. We each have each have a lane, and that's okay. Like it's one modality, we're one person. We can't know everything all of the time. I'm stunned at how much like the fact you have all these layers of modalities. Like it just sounds like so much in my brain to handle, with the physical and the muscular and the nervous system and the energetic and all. Woo.
So here's the thing. Oh, go ahead. I didn't mean to.
Oh, no, not at all. No, it's just heartening to think of seeing Western medicines like taking all the best bits, and how lovely, what a great collection of bits it is to be used judiciously in the right circumstances.
Yes. I don't think most people, they really want to get rid of Western medicine. They just want it to be better.
Yeah, absolutely.
They just want it to be better.
Yep.
And I play the role of filling in what Western medicine really can't do. That there's not enough time, and you get your doctor maybe for a half an hour. How many times a year? Not that often. So, I'm seeing patients for an hour and 15 minutes. Most of my patients for an hour and 15 minutes. Initially every week, then maybe every other week. And I really get to know the person. And in knowing the person, it becomes possible to see where the imbalance is. And the imbalance may be in this 5-element, 5-organ system that we're trained in traditional Chinese medicine. There may be a structural imbalance. There may be their posture might be off, which is causing pain. They may be in a work or personal situation that's not right for them. And they may be eating foods that don't really help to nurture the body and keep the body functioning. as well as possible. And so and some of those things I can help with, and others I can tell them, you know, this is what I see. And I refer out fairly often when there are things that come up that are very complex, that are not in my area of expertise. But the ability to recognize imbalances, even if they're subtle, you know, before it's a real problem in the body. When they're subtle, when the problem is beginning, to recognize and correct that, and teach or inspire the patient to recognize and correct it in their own lives, is this beautiful kind of miraculous thing. And, you know, so.
Yeah, and it's a piece of what makes this kind of medicine. So it's one, I think one of the ways in which is fundamentally different from Western medicine is Western medicine takes care of the crisis, the end result of the series of emotional difficulties, physical difficulties, food difficulties, and then you've got this, you know, very obvious problem in the body. Whereas, you know, the acupuncture model is, what do we do to encourage the body's best sense of health, getting at the issues well in advance, so the person can take charge of the things that are actually, you know, the person can find out what's going on with their body and take responsibility in charge of helping to get their body the things that it needs, and then never getting to that crisis point. And I think it's one of the things that another paradigm shift for me is getting out of the mindset of, you know, not owning, you know, not believing we have agency over our health in such a vastly greater way than we've ever really been taught, even, I think.
Yes. I try a lot with my patients to have an understanding of what's going on in the body. I mean, the treatments, I'm not in my head at all. You know, I've studied stuff, and, you know, the body responds however the body responds. I don't have to fully understand everything that's going on. I just have to follow the body. You know, it's kind of like being in dance with the body. And you just, you know, in dancing with your partner, you're following and they're following you. There's this kind of interactive, you know, movement going on. And it feels like that.
It's a collaboration too. It's not, that's the other thing that feels different from Western medicine, is it's a conscious collaboration where you're really trying to work with the patient's healing, you know, healing and both how their own body heals itself, and then also the information that they use to continue the healing. You know, it becomes collaboration between themselves and the practitioner, rather than, you know, doctor heal me, which you know, fix me, heal me, take care of this for me mentality instead.
Yes. So, you know, my tagline is reclaim your power to heal, because that's really what I'm, you know, and that's really what I'm doing. Because I say, I just facilitate. I mean, you know, so I put a needle in, you know, or I do some body work. I'm just facilitating. It's your body, you know. And, you know, sometimes I say to people, look, you're not in pain. It's pretty easy to get a person out of pain when they're on the table. Do you know what I mean? They're on the table, they're relaxed. One of the big things that I make a real effort to do is help the person feel safe in my office. And because I think that's a really important part of healing. It's not so much believing. It's not so important to me if they believe in acupuncture or don't believe in acupuncture or understand it. I want them to feel safe and comfortable when they come to see me. I want them to feel attended to. So things like, you know, is the office warm enough, and do you like the music and all that kind of stuff. That's a really important part of the journey. And so in that safe space, it's not that difficult to get people out of pain. It's not that difficult to get people to feel relaxed and comfortable. I'm sure, Stacy, you have this also, you know. They're lying on the table, they're
Yeah, I was actually massage school. It's so funny because I picked my program. It doesn't exist anymore, but it's a wonderful program at Springfield Technical Community College. And I went after it specifically because they advertised a lot about the medicine of massage, right? The learning the musculoskeletal system, have good, lots of anatomy and all that. So I was all excited for like this meaty, really diagnostic style. And our very first day, she had us just do scalp massages for each other just start right away with the touch. And she dimmed down the lights and turned on the soft music. I thought, oh, but what? What's the point of this? Like, I don't want to do spa massage. I want to do like medicine massage. And it was a couple more classes before I realized that is part of the medicine, Stacy.
Yeah.
That's,
Yes.
That's medicine. It's not just foofy, bells and whistles. It's a necessary part of the experience to help the person relax so their body can heal in the first place.
Yeah.
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 No, go ahead.
So that's relatively easy in the office where it's safe and they're being attended to, and I'm not I do tough love, but I'm a pretty compassionate and kind person. What's more challenging is when they leave the office. So I try to really get them to understand that if they could be relaxed in the office, they can also be relaxed when they're not in the office, because it's their body. They're still in the same form. And that becomes a little more challenging because when people go out into the world, the stresses that created whatever the problem was usually don't go away. I mean, that's just the nature of life.
Mm-hmm.
And so my best feeling often is when a patient comes in and they'll say to me, I'm feeling better. I'm not so sure if it was the treatment because I'm also exercising and eating right. And, whatever it is, I got out of a bad relationship, whatever it is, and I'm like, yes, that's it. That's it.
Well, that's the other paradigm shift too that I realized was there's the Western mentality is you go and get the surgery and then you're good. You go and get the pill and then you're good. But Western holistic medicine is you do a lot of different things at the same time, and each of them builds on each other and complements each other, and then you end up and you can't point to any one thing as being the reason you feel better. It was all of it together, and thinking again the holistic minded, not just within the modality, but in bringing in lots of different healing activities for yourself to resolve an issue. I mean, I struggled with thyroid disease, and it turned out to be a gut health issue. And it was also affecting my musculoskeletal system. So I was at the chiropractor and the naturopath and going to acupuncture, all three, to feel better. And I've always had to do that whenever I had something significant going on. And I have people come to my office and they're just coming to me like, I'm just getting massage. That's great. But you should also think about acupuncture and or a physical therapist and or a chiropractor to deal with your issue, because it's when you've got something chronic like this, that's the best choice.
Yes. And I mean, I came up with this way of thinking because I was diagnosed with chronic fatigue syndrome in 1990, and there wasn't a standard. I was lucky. I was correctly diagnosed, and I was my primary care physician was really doing what we now call functional medicine, which is, looking outside of just Western medicine for solutions, for a way of understanding the body. And so we would just try a whole bunch of different things. And if they worked, great. If they didn't work, okay. And my way of thinking about it was, if it doesn't cause harm to my body, I'm willing to try it. If I don't like it, fine. And that's really how I got healthy. I mean, I was getting acupuncture. I became an acupuncturist because of that, because I started getting acupuncture treatments for chronic fatigue. And that experience made me realize that illness is not just a set of diagnoses. illness is more like the traditional Chinese medicine model, which is imbalances in the body, which can be corrected. And so as I was learning traditional Chinese medicine and then Japanese acupuncture, I was also struggling with this illness and having to figure out, okay, how am I going to get healthy? Based on we didn't have science for this at that time. It was really new. They were just starting to do studies, and it's not an easy condition to treat. And so it was a lot of trial and error. And so I took that experience into my practice when I started treating people, that you don't really know what the thing is that's going to help you. You have to sort of come at it with a very open mind. You don't have to understand all the modalities, just like we don't understand how our smartphones work, and yet we use our smartphones, right? Nobody would say, wait, we're not going to use the smartphone until everybody becomes an engineer,
Right.
So we don't fully understand how acupuncture, this whole model, we don't fully understand scientifically how it works. We have 3,000 years of evidence that it does work because it's still here and we're still practicing it. And,
Yeah, interesting. It kind of gave me got a different lens perspective on chronic fatigue syndrome and other syndromes where I assume that's in fact why Western medicine has struggled so much. So with chronic fatigue syndrome, you mentioned before we got started that there's a 10 symptom list. And that if you have at least 5 of those symptoms, you receive a diagnosis of chronic fatigue syndrome. When you have plantar fasciitis and your foot is in terrible pain, there's never one automatic reason for that fasciitis. There could be a host of reasons why the fasciitis is happening. And I assume it's the same thing for chronic fatigue syndrome, where they have like this blanket diagnosis of there's these 10 symptoms. If you have 5, we're going to call it chronic fatigue. But in fact, each individual could have entirely different reasons why they're suffering from those symptoms. Does that sound true?
Yeah, I think that's true.
And that's why Western medicine struggles, is because they're looking for the answer, capital T, capital A. And for most people, there isn't. And they don't even have, and their modality doesn't have a lot of tools for fine tuning the sources of the chronic fatigue. They don't necessarily look at diet. They don't necessarily look at the stress at home. And so they miss the reasons why. And so that's why honestly, most people I know who have chronic illnesses end up in holistic medicine, because that's one thing that Western medicine tends to have a particularly difficult time with, is any meaningful treatment for things like chronic fatigue or fibromyalgia or the other kind of blanket diagnoses that can have multiple reasons for why you're suffering from those symptoms.
I remember when I was going to an acupuncturist who became one of my teachers. And he said, when I first heard about chronic fatigue, I didn't believe it because it just didn't seem, he said, and then I started feeling people's pulses and, oh yeah.
Oh, interesting.
Oh, yeah.
Can you actually talk about that? So the term pulse in Chinese medicine, I still don't quite get it. Maybe it's too complicated to explain, but I'd like to know a little bit more about what that, because you said it earlier too, and I was going to say, oh, maybe you should explain that a little bit for myself as much as anybody else. But can you just?
So we're not talking about finger on the wrist beating.
Yes. No, we are, but okay. It's 3 fingers on each wrist. Each finger. So the 3 positions are closest to the wrist crease, then 1 finger width over, and then 2 finger widths over. On the right hand, the first position is the lungs. The second position is spleen, and the third position is kidney. And on the left hand, the first position is heart, the second position is liver, and the third position is also kidney. Kidneys have a very big sort of center stage in a lot of in Chinese medicine. So you feel each of the different positions. You feel the strength of the pulse. You feel the speed of the pulse. You feel the quality of the pulse. And when they teach it to us, it's like poetry. They try to describe, there are like 28, different pulse qualities, and it's very complicated. It's very complicated. Kiko, when she was training with Master Nagano in Japan, she said from the pulse, he could tell you your whole life history. She said, your whole health history from the pulse. She said, I'm never going to be able to do that. So she translated those pulse readings into palpation. Does that make sense?
Oh, okay.
So
Interesting.
if you press on certain part of the abdomen, that's kidney region, that's lung region, that's liver region, that's spleen region, that's heart region. And so she made that kind of leap, which made it so much easier for us over here, because it can take several lifetimes to be that confident in pulse reading. It's nobody knows what you're experiencing. There's not a way to measure. You feel the pulse, you feel one thing, somebody else might feel something else, and we don't know exactly what that is. So they teach us the different qualities, and they teach us the different positions, and then it's even more complicated because at each position there are 3 layers. There's the superficial layer, there's the middle layer, and then there's a layer that's closest to the bone. So it's very, very, very complicated, and it does give a lot of information about the body. So in Western medicine, they go by pulse rate. It's one thing. We have like 28 different things that you can feel in the pulse. And yeah, it's kind of amazing. It's kind of amazing.
And it's amazing that the colleague said that he could feel the chronic fatigue person's feel it in the pulse right away. This again for people out there who have a chronic illness that's undiagnosable, quote unquote, to just go to a acupuncturist and check all the pulses. And it's just, again, with the look, there's information on what's happening.
It's more information.
Mm-hmm.
Yeah.
What's happening and why it's happening.
We would call like chronic fatigue. It's everything in Chinese medicine. It's either excess or deficiency if there's an imbalance. The chronic fatigue is a situation where you have a lot of deficiency in the body. So you have a deficient pulse. I mean, it kind of makes sense. But it's really hard when you have that kind of chronic illness that nobody understands to try to explain to somebody, this is what's going on. I used to be a very high achieving, active person, and now I'm having trouble walking across a room, but I still look healthy. I'm not in pain. It's very hard for anybody to really wrap their brains around that thing.
Yeah, I know. And I know of at least 2 people who, one turned out to have chronic fatigue syndrome. Another one was suffering from, I think it was fibromyalgia. And for years, doctors telling them it was in their head. And the relief they felt when they went to a holistic practitioner who said, "Oh no, you have a thing going on. It's yes, you are something deficient, something's going," and just the complete like bursting into tears moment of, "Oh my goodness, thank you, finally someone believes me and has something they can help and they can do something for it. There's somewhere to go with this. I'm not just trapped in this syndrome."
Yeah. So there are so many things we just don't understand, but we don't have to fully understand something to find ways of remedying it.
Yeah, right. And I guess that's another Western thing too, isn't it? Like the need for things to be very the scientific method, like you have to having very specific controls and specific outcomes and specific data that you're always able to collect repetitively every time. And I thought it was interesting you said how even with the pulses you get different people's interpretation of a pulse in the wrist sometimes. But it doesn't mean there isn't something going on in the pulse. It's just the variation of people, and how Western medicine tries to eliminate the variations, right? And have something that's reproduce, but there's the scientific method standard, like reproducible, and all of that. And that there's a certain amount of art in your modality that it can't be quantified in the same way. And then for such a long time, I remember in the 80s, acupuncture being maligned as being, make-believe, because it didn't have that scientific absolutism about it.
And with some doctors, it's still maligned. I had a patient come to me. She had one doctor who sent her to me with back pain. Okay. Her primary care sent her to Spine and Sports, where they do cortisone shots. And so he sent her to me. It was clear that she had a problem. She was in a lot of pain. She had trouble walking. It was very clear. She presented in a very, very clear way. And after a couple of sessions, she said to me, I was like 10 plus in terms of pain. And after a couple of sessions, we got rid of the pain. And with her, I also said, I think you should change your diet. And I gave her some suggestions and stop eating the crap. And she came in one day, she said, my husband brought all these donuts. She said, I didn't have any, and now he's not bringing donuts into the house anymore. It was like, great. So she made some changes. She was able to go back to exercising. And this was an older person, I think in her 70s. And it was very clear that acupuncture and lifestyle changes got her feeling better. And she went back to her doctor once a year. She would have to go to a doctor. And the doctor said, oh, your back pain's better. And she said, yes. And he said, oh, Spine and Sports must have done a really good job. And she said, excuse me, it was not Spine and Sports. I went to an acupuncturist and he said, oh, it's all in your head. When there was a clear, she could touch her toes. She was walking. So,
my goodness.
A lot of us are just like, okay, that's their loss,
And it is such a loss. And then there's the doctors who are shifting. I know an acupuncturist who, there's a neurologist who sends her patient when he can't figure out what's going on, or he sends them to her for acupuncture, so there's the overlap. It does feel like it's finally starting to infiltrate into the minds of the Western doctors, that it's a useful referral for their patients.
Yeah. And I tell my patients, tell your doctors, just so that they know, because a lot of them, yes, they're open to it. If they're not, why would they understand it? It's a completely different system.
It really is.
Completely different system. But I think they should be open to something. We have, it's not something that's harmful. And I think this is really, really important. People can get a little nervous because of the needles, and that's something that I have to really, I show people the needles, their hair-like. I'm on the very, very gentle side of the spectrum in terms of needling. So the needles themselves, getting needled is not a painful thing. Once the needle's in, you don't feel it anymore. And we don't see side effects. we don't. So there's really not a reason for somebody not to try it. And I think that that's important, that people should know that it's so much safer than any Western actual procedure that I know of. So much safer. And we see so much benefit. And so I think it's important for people. It's not that they have to understand the whole system or believe in the whole system, but to give it a chance as a treatment modality. I think it's also important, and I'm better at this now, for people to realize it takes several treatments. They can't expect to just come in And, people think, they call me up and they're like, okay, on the second visit, am I going to feel this much better? Like what? And I say, honestly, I don't really know, because it's your body. Each person is different. Some people, right on the table, they get a very clear response. For some people, it's 2 days later, they come back to me and they say, 2 days later, I really felt a difference. Some people, the treatments last for a certain amount of time. What we do know is if you give it a span of 5 to 10 initial visits, we start to see a real shift. And what I also know is for the people who do those initial sets of visits, when they come back, because sometimes people will come in, have back pain. Okay, they come 5 to 10 visits, the back pain's gone, and then they throw their back out again several months later. They're so much easier to treat. I can't fully explain it. Well, I have more knowledge, they have more knowledge, but the body's learned something. So I go back and I put the needles in, and the body's like, okay, I remember this, And so I think it's really important for people to understand that it's a very different modality with different sets of expectations and ways of working than what we think of as medicine. It's all medicine. I mean, we're all doing something to the body to help it feel better, get healthier. But the way of measuring it and the treatment time is vastly different for acupuncture, a lot of the other alternative therapies, than for taking a pill. Vastly different. And so I think it's really important for people to come in with that realization. Now, I don't take patients unless they're really willing to sign up for that set of 5 treatments. And I tell them, you're wasting your money otherwise, because otherwise every time I have to do a whole conversation with them. Did you feel a little better? Did you, what? And to really give it a chance to get the results that you want, it's gonna take a little bit of time.
Mm-hmm.
It's so true and so funny how a lot of the alternative wellness modalities have this kind of critique put against them, but the conventionals have the same thing. Like if a person's having digestive issues, if they're having heartburn and indigestion and bloating, eating healthy for one meal doesn't magically cure that. But like when you get into the habit of eating healthy consistently, and then your whole system readjusts, and then all of a sudden it's all of that stuff is gone, the heartburn's gone and the bloating's gone, you can digest more normally, like you bring it back to, like, the system realigns back to where it's supposed to be.
Mm-hmm.
And it's so funny from my perspective. I get it. I've heard it said many a times as well, of wanting the instant fix, but it's like that doesn't work for a person's body. Like you need, like you said, you need that level of commitment to the healing, and that like you're going after trying to repair the whole system at once and rebalancing all of these different things that could have been, who knows how long the scales were off before they even saw you.
Yes. Yeah.
Well, that's the fundamental difference right there. I realized that I mean, I'm older, and maybe I am reading into the lessons I got from Western medicine, but I had the impression when I was younger that the pills fixed you, like that you took medicine, that it fixed the problem. And it wasn't until recently that I really, they're all symptom management. And so there's I think the fundamental, like, again, culture paradigm shift of it takes time because your body's actually healing.
Yeah.
It's not just getting a symptom relief in that moment. And so, of course, that is, as you say, Eric, with the diet example, it takes time for the body to heal from the lousy food or heal from the inflammation or whatever it is. And so, therefore, it's not going to be instantaneous. So, like I'm thinking of a tapping Thursday, Eric. So, because it's about the limiting belief that not even I think just the fundamental limiting belief that we do need someone else to heal us, that someone else has to be the one to fix what's happening, and that the fact we can, in fact, heal completely the thing that's happening in our body. We don't just have to manage symptoms and pop a pill every day. You know, my dad took reflux medication for 15 years of his life, and no doctor ever thought to find out why he had chronic reflux. You know, I hear that story over and over and over again, but just, it's a thing to tap on, like our belief that we need someone else to heal us, and that our bodies aren't capable of recovering ourselves with support from these illnesses that we'll all may be suffering from.
And just like what Bonnie was saying, you know, how acupuncture, the act has no side effect. The other thing that a lot of times with Western medicine that people can be ignorant of is like, there's a side effect for almost everything. You know, you take the antibiotic, yeah, you could get rid of the illness, but you're also completely wrecking your whole digestive system in the process. You know,
Yeah, that happened to me.
Yeah, and you know, there's a reason why all of those medication commercials have like the 20 minutes of may cause and it's like, you know, and then it's like, you know, from Bonnie's perspective, it's like, what, you know, what's the worst side effect from getting a needle? And like a single droplet of blood, maybe on the rare occasion, if at all. And so it's that same kind of thing as well, of just the blindness to the cost of Western medicine. Not to say that, not to throw it away. None of us are saying to throw it away.
Yeah.
But it's needing to have that, the open eyes that there is more than Western medicine, and that Western medicine can work alongside a lot of other modalities, like what Bonnie's been describing. But that there's also the needing to be open to the fact that Western medicine does have a cost, and sometimes the cost might not be worth it. That like there might be other modalities where the cost is lower and be worth giving the effort into first before going into something more drastic that could have a really negative effect.
And thinking in terms of looking for root causes rather than symptom management.
Yeah.
Like you know, just like that if we just do that, like, that'll be a huge, for me in my experience with doctors, that by itself is a huge paradigm shift, to look for root causes and help the body heal once you find the root cause. Like that's it.
Yeah. And I have to say, acupuncture is not contraindicated for any types of Western medicine. So you can be taking medication, you can have surgery.
I wondered about that. Yeah.
You know, so if there's surgery, obviously we don't needle into open wounds or new scars or you know, but there's not a reason. And sometimes people have this misconception that, you know, I'm doing Western medicine, going the Western route, and then I'll come to you. And I try to, you know, I'm getting physical therapy, so I'm going to wait until I finish my physical therapy, and then I'll come to you. And that's really not how it works. Whatever you're going into surgery, it makes sense to have acupuncture before you go into surgery. The body's going to be in a healthier state. You've just had surgery, it makes sense to have acupuncture after surgery to get the body to heal more quickly. I once, many years ago, my nephew, he must have been 9 or 10, he's, you know, we were sitting at the dinner table and we were talking, and he said, so what do you do? And I had to try to explain, you know, I'm an acupuncturist. Well, what does that mean? I said, I get the body to heal faster. That's what I do. I get the body to heal faster. And that's always a good thing. I mean, you know.
It is. And I think the mentality of Western medicine that we are the fixers is lacks respect and humility in regard to the healing process with the patient. You know, that we should be collaborators, so we're not in charge, we're not fixing anybody, and that that's what we're facilitators, as you said, and that's again such a more respectful way to deal with the person who's suffering.
Yeah.
Awesome. So Bonnie,
Yeah.
How can people find you if they're in Western Massachusetts?
They can go to my website, which is bonniediamond.com, BONNIEDIAMOND.com. That's probably the easiest way. They can call me, but people should really go to my website. That's the easiest way to get information about how I work and when I'm available and all of that. And I'll just say, we haven't talked a whole lot about it, but I also do cranial sacral therapy, which I've been doing for about the past year. And I often combine that with the acupuncture, which has a way of putting the body into even more relaxed state and I think greater ability to heal. So that's another thing that I offer that's different from a lot of other acupuncturists. And I do it because the first patient that I practiced cranial sacral treatment on, she had rheumatoid arthritis and she had been in pain for several months. And she came in, I did a half an hour cranial treatment and I was doing the ear clinic at the time. So I did 2 ear points and some cranial sacral therapy. Pain was gone. So after that, I'm like, wow. Okay. That's another thing, another tool in my toolkit. So
nice.
That's awesome.
Yeah.
Any last words of wisdom before we let you go?
That people really have the ability to heal. Not that, there's still the aging process, the body breaks down, there's no question about that, but that people have more options, there are more possibilities than I think a lot of people think of. And I just want people to know that so that they, they don't have to suffer as much, that their bodies can get care and attention. And, that's really my wish for everybody, that their bodies get the care and attention that they deserve.
Awesome.
Lovely.
Well, thank you so much for talking with us today. It's been awesome to hear about everything that you do and the mission that you have just to help people heal quicker and faster and give them that space for comfort. And once again, that's bonniediamond.com for all of our listeners. And thanks again, Bonnie. It's been a pleasure.
Great to be here.
Until next time.